from the American Academy of Pediatrics.
It is back to school season, which is one of the busiest times for both parents and pediatricians alike. One of the many reasons it is so busy is that a lot of kids need physicals in general, and they may need to be cleared for sports. Today, we talk about what goes into officially clearing kids for sports and ways we work together to keep kids' hearts healthy.
Most of what comes to me as a pediatric electrophysiologist is tragic cases of kids playing and nobody having a defibrillator, nobody knowing what a defibrillator is, and the kid passing right in front of everybody's eyes. So I think that. And then another really important thing is to have every patient and everybody learn how to do CPR.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions and the answers will hopefully be even better. Let's get started. I'm joined today by Dr. Christopher Snyder, who is the Chief of Pediatric Cardiology at Children's Hospital of Richmond, and we're talking all about sports physicals and heart health for young athletes. Chris, welcome.
Well, thank you very much for having me, and thank everyone for listening and paying attention to our conversation.
Yeah, we're so excited to have you. There's so much to talk about. There's, of course, a lot that we do in well-child visits, from monitoring growth and development to checking blood pressures and vision and catching up kids on vaccines and so much more. But today, we're really here to talk about sports clearance in particular. So I'm wondering if we can start by having you explain the difference between a standard well-child visit and what we call a pre-participation sports screening.
Yeah. Excellent. Well, there's not a whole lot of difference between the two. To me, the really important things in this are, one is getting the questions that the family has to answer beforehand. And many of those are family history questions, but there are also a lot of other questions in there that are sort of buried in there that are just as important as the heart. And I can't believe that a cardiologist is saying that there are other organs just as important as the heart. But there are, and it requires a lot of other things that pediatricians do much better than we do in pediatric cardiology. The psychological questions that you have, the screening to make sure that the child is safe at home, make sure they're not depressed, make sure they're not overly stressed. And then, looking for weight gain and all those things. So there's so much wrapped up into it that I would even say that if I were a pediatrician, and I am, but if I were a pediatrician, I'd wrap that pre-sports physical exam into their yearly visit when they're an adolescent and make it all one big part, because there's so much that really needs to be covered in this exam.
Yeah, no, absolutely. And I think a lot of us do when families tell us that kids are about to be playing sports, right? We sort of pause for a minute, make sure that we've asked the right family history questions and are doing the right parts of the exam, et cetera, to be able to clear kids for sports. So just briefly, Chris, I wonder if you can just tell us the key elements that are included in a sports physical that are sort of what I call the extra, right? In addition to all the things that we're doing in the well-child visit.
Yeah, well, a lot of it isn't necessarily extra, but it's the ones that will make you stop and think. From my perspective, the historical questions that you're going to ask a kid, or do you have chest pain or shortness of breath with exercise, right? We aren't necessarily concerned about a kid waking up and having chest pain, but if they're exercising and they're having chest pain, they have to come to see a pediatric cardiologist. Shortness of breath with exercise is either us or a pulmonologist or a pediatrician treating their exercise-induced asthma. Those are really important. If the child passes out, passing out is one of those things that oftentimes is a red flag that we don't want a kid to be passing out, especially if they're passing out while playing. And then really the other ones are looking for high blood pressure. And then on the other side, the family history, I think the pediatrician's office is the place that these need to be done, because if mom and dad come for every one of these visits and then it's only mom, you're going to say, where's dad? And mom's going to say, well, dad died 6 months ago from this, that, or the other thing. And so y'all are very involved with the families. And so you'll know the family history of
Yeah.
hypertension, stroke, heart disease, inherited cardiomyopathies, long QTs, the things that really would completely restrict a kid from playing.
Yeah, no, absolutely. And I think, just hearing you talk, some of the most common ones we encounter are, of course, the shortness of breath with exercise, which may or may not be from, a heart condition. The passing out while exercising, I have seen, unfortunately. And as you mentioned, perhaps there was some dehydration. And we usually can sort through that, but a lot more times than not, I'm sending those kiddos to see a pediatric cardiologist like yourself because I cannot miss, right? Those are one of those things that you absolutely cannot miss. A heart condition that is leading to the child passing out while exercising. It's too serious, too scary to miss it. Now, in terms of the family history, and hopefully, again, everyone is doing this at their pediatrician regularly. It's funny when I say extra, it's like when someone tells me they're about to play sports and they need to be cleared, I do pay extra attention to these things, but you're right. They're happening in the background.
Mhm.
We're always screening. We're always asking. We need to pay additional attention, but ideally these things are happening. So again, what kinds of questions should families expect in terms of the family history when it comes to screening for heart conditions specifically?
So the questions that the families are going to get are on the form. And if the family participates with the child that's going to participate, the questions are spelled out right there. They're a simple yes or a no. And they're looking for things like high blood pressure or other family members who have died for unusual or unknown causes.
Yeah.
And if there is a check, yes, passed out, short of breath. The family history questions are, any inherited cardiomyopathies. It's the way I ask questions when I go see a family has anybody in the family died for any reason under the age of 50?
Yeah, right.
And if any of those come up when you're seeing them, those should be a red flag where you should send them on to a pediatric cardiologist, a pulmonologist, or whoever else you think is necessary.
Yeah. And, I have a very low threshold to send to you, truly, especially when it comes to these things with these, sudden deaths under the age of 50 in the family. I mean, we don't play games with those things. I'm very quick to send to you. Now, just to back it up for a second, right? Before I send to you, and again, really quick to send to you, I do encounter a lot of parents who ask me about the role of EKGs and other tests in screening for heart issues, specifically in our offices as a primary care pediatrician. I'm sure you've been asked this many times.
Mhm.
What do you think? Is there a role for those things in screening?
Well, I think if you send the patient to me, they're going to get an EKG.
Right.
You send a patient to a pediatric cardiologist, 100% of them are going to get an EKG. The EKG is an excellent screening tool, but the EKG outside the hand of somebody who interprets hundreds and thousands of them, it's hard to interpret because the EKG machine is set up to interpret for adults. And I think most pediatricians are going to do 100 a year, and it's hard to keep up your skill set and interpreting them
Yes.
and that. And so I'm not a huge fan of companies going out and screening. It does sometimes show some abnormalities, but in general, it can miss a lot of things. And I think that if they fill out the forms and they come to your office and you send them to us, they get better care. They're told exactly what their child has, and then they don't have to worry about it.
Yeah, this is what you do, right? Day in, day
Yeah.
out, you look at the heart. It is your organ. This is what you do. I don't do those regularly to screen, right? The EKGs, other tests. Like families always ask, right? Is there something else we should be doing to screen? But I do think between the questionnaires, a good physical exam, good family history, as we said, which, is asked in those questionnaires, any suspicion we're sending to you. So hopefully families are feeling reassured by that. Now, I do want to ask, and I want to move on to what happens once kids are playing sports, but I do want to ask before we do, is there any signs, Chris, of underlying heart disease that parents shouldn't ignore? I mean, hopefully they know their family history, they're going to the pediatrician regularly, but at home with your child, is there any sign of underlying heart disease that should make you stop and say, let me go back to my pediatrician?
Yeah, sure. So the first one, I think, goes to the psychology of the family. I've seen hundreds of thousands of kids with syncope, and the family say
Just
this is the first
fainting,
time they
right?
passed out. And then
Yeah.
the kids go, no, I passed out 12 other times. So making sure you have dinner at the table and you know what your children are doing so that you know if they're running and they're the slowest kid in the neighborhood or they can't keep up or they can't do things. I think that that's really important. Those are warning signs if your child is passing out. I mean, completely passing out, especially during exercise.
Yeah.
Okay. Every one of us will pass out at least once when we stand up quickly or do something like that. But the ones that pass out while they're exercising, to me, that's a medical emergency. Okay. That's you calling me in my office and me saying, send the kid to the emergency room. So I've seen too many of those. Those are really the things. And then just making sure that your child can continue to exercise and they're not falling off the curve of being able to run a mile, 6 months ago, and now they can't do it. Those are really the kind of things that the parents need to look at. And then something that we haven't touched on that I think is really important is drugs. PEDs can affect the child's heart, their
Performance
liver.
enhancement drugs, right?
Yes, yeah, can affect the children, kids, adults, right? And it's hard when you're a kid who wants to play on a
Right.
football team or something like that. It's hard to make sure that you aren't doing that, but those are the kind of things that a kid is not going to admit to their pediatrician and maybe not to their parent. But if the
Yeah.
parent has any suspicion, they should bring them to you, and then you can help get those issues sought and brought out.
Chris, that is such a good point because I have to tell you, at the beginning of my practice, right, and I've been working as a pediatrician now for almost a decade, but I don't know that I was always asking. I was, of course, saying, like, are your friends or you using any drugs or alcohol? I don't know that I was always spelling out all of the things. Then I started spelling out all of the things, but I was leaving out the performance enhancing drugs, right, like the steroids. And now, especially when I see a child that's playing sports, I'm starting to ask regularly. And
Mhm.
in my practice, it hasn't been something that kids are using regularly, but I have found a couple who just want to bulk up, right? They're targeted for something on social media or their friends are telling them. So it does happen. I do think it's something we need to ask about more regularly. You probably see more than I do because the kids come to you, right?
Yeah.
Yeah, I'm so glad you brought that up. It is something we should be asking about
Well,
a
and
little bit
it's not
more.
just that, it's also all of the energy drinks. The only energy drink that
Right.
was available when I was growing up was something called Tang, which is no longer sold.
Yeah.
And now, we have lots of kids come in with palpitations, which is another thing that you
Yeah.
as a pediatrician should worry about. It generally is nothing hard, but when a kid has palpitations, they should be sent to us. But if they're drinking 9 Monster Energy drinks a day, they should have palpitations. And those are the kind of things that oftentimes don't come out and especially might not come out in front of the parents. And
Right.
so, yeah, sometimes have to separate them and say, are you drinking a lot of these things and get them off of them?
Yeah, very discreetly, very professionally. It is part of what we do regularly in our offices, but we really need to understand what they're using, especially if they're having some of those symptoms. Now, Chris, to talk about what happens again, hopefully, history has been taken, an amazing exam has happened. We've screened the kids, we have cleared them, they're good to go to play sports. Once they're in schools or in organized sports, is there any equipment that should be present wherever kids are playing sports? And is that something that we should be asking about as parents?
Yes. So I think it's extremely important that every school participates in this thing called Project Adam. Project Adam is a nationwide thing where they're trying to get every school to have a number of defibrillators, things that would shock a patient if they went out and had a bad heart rhythm. And then also to train at least 10 people in the school to be able to do CPR on patients. This is a huge thing. In the state of Virginia, we have 72 schools currently in it, but I think every school needs it. And what really it occurs is when a school gets it, 7 out of 10 saves are in adults.
Wow.
Grandfather goes to the game, he passes out, they do CPR on him and save his life. But I think doing Project Atom or making sure that there's a defibrillator, most of what comes to me as a pediatric electrophysiologist is tragic cases of kids playing and nobody having a defibrillator, nobody knowing what a defibrillator is, and the kid passing right in front of everybody's eyes. So I think that. And then another really important thing is to have every patient and everybody learn how to do CPR.
Yes. Yes, absolutely. I mean, it can really save a life, right? Like, regardless of whether you're talking about athletes or schools, it really can save a life. You just never know.
Right.
Chris, any other advice for coaches and school staff in spotting and responding to cardiac emergencies?
Yeah, well, I think every school now is mandated through a federal law that they have to have an action plan. And the action plan would evolve where the coaches, the athletic trainers know exactly what to do, because this is very important. Whenever you're in a high stress situation in your office, you know somebody is calling for the ambulance, somebody else is talking to the parents, you're helping the child out. You need that same thing, because I've been in a lot of these situations where some people come in and they just freeze when they see things like this. So having an action plan at every school is really important. Even in Little League, they should have an action plan for who does what, so that somebody knows that they go to the patient, somebody else goes finds a phone, somebody else gets a defibrillator, those sort of things to help with those sort of things. I think that that's really important. And sudden deaths rarely occur in kids under the age of 12. So you're not talking about elementary school, although it does happen. You're talking about middle school and high school, but making sure that the sports teams, all the teams, whenever even the band goes, they should have a defibrillator, and the band director should know, because band is a sport, cheerleading is a sport, they're all sports. And so making sure that they have that. And if something happens, having that practiced emergency action plan so that the band director isn't stuck going, what do I do? The band director knows exactly what their responsibility is and how to get other people to do theirs.
I'm so glad I just asked you that question, because you just gave us some really, really good information on what to expect and what standard of care, right? As we call it, standard of care, like what should be the gold standard anywhere that children are playing sports. And that includes band, cheerleading, et cetera. But, I have no problem saying I'm not a person that's easily embarrassed. I will ask any question of anyone. Like, I have no problem asking a coach, hey, do you guys have a defibrillator? Do you guys have an action plan? Are you guys trained in CPR? I have no problem asking those questions. But I wonder, for the parent listening who is not a pediatrician, right? And who perhaps is a little more shy than I am, should they feel embarrassed about asking these questions? Like, are the sports staff expecting parents to ask this question? What is your take on this?
Yeah, it's an excellent question. I think that if you want your child coached by anybody, that coach should say, excellent question, something we haven't thought of, but we certainly need to do this. If the coach says, oh, we don't need that, that might not be the coach, right?
Yep, red flag.
And I will say the vast majority of coaches, and to get any kind of certification in states at high school levels and middle school levels, they have to go through certification now. But even Little League coaches and things like that, I've had a kid who was hit by a baseball and got something called commotio cordis, where he dropped immediately. So I think everybody needs to understand it. I think if the coach goes crazy, then it's the wrong coach. But if the coach says, wow, that's great, then I think the best thing to do is to go out and have everybody in the Little League or whatever organization it is pool their money, get a defibrillator, have the American Heart Association or the fire station come out and teach you how to do hands-only CPR. That will raise everybody else's level and ability so that when they're walking down the street, if something happens, they'll save somebody else. Probably unlikely that a kid is going to do this, but we use kids to make sure that everybody can do this.
Yes, no, and you want to protect your child even in these unlikely scenarios. So absolutely. I love that you're reminding us that it is within our power to go out and get organized and get a defibrillator and seek out the training so that we're all feeling more prepared and safe. And Chris, of course, we've been focused on sports today, but I wonder, how can families help protect their kids' heart health year round, not just before sports season or during sports?
Excellent. Well, I think the most important thing, and you know this probably better than anybody else, is exercise is the cure for everything.
Yeah.
There's a recent paper that showed that exercise is the best treatment for anxiety. Exercise is the best treatment for depression. Better than medicines, better than anything else, exercise. So I tell this to all of my patients that I want them to do a minimum of 30 minutes of exercise. And when I say that, they go, oh, whoa, I don't want to do it. But 30 minutes of walking is fine. Ideal is 60 minutes. And then they say, well, I walk to school. And I say, well, I walk into the hospital, but that doesn't count either. So getting them to exercise, and usually what you can do is, especially as a pediatrician, their family's there. And you can talk to the kid, but then you can say, take your mom out for a walk. Go with your dad. Take your dog. People with dogs live 2 years longer than people without dogs because they walk them.
I love that.
Having exercise every day is really important. Okay. I also think that eating healthy, and I always tell people that doesn't mean that you can't have ice cream or cookies. But what I do and how I grew up was that my dad didn't say we couldn't have them, but we had to go out and get them. And if you have to go out and get them and it's 8:00 at night and you're in your PJs, you're not going to go get them. And so I think, making healthy choices. And then the big one is I tell them never, ever to smoke. I think smoking is becoming less prevalent, but now we have kids that are vaping and we don't even know what vaping does. And smoking of all kinds, marijuana and cigarettes, is really bad for your heart. It's bad for your lungs. It's going to cause strokes, heart attacks, the brain development, peripheral vascular disease, all those things.
Yeah, it is bad news all around. And whatever we do know about vaping is not looking good. It is really not looking good. So absolutely. So appreciate all of those. And as we come to the end of the show, Chris, we like to end with what we call a parenting prescription. So when it comes to heart health, especially as it relates to sports, what is one thing you want all parents to remember?
Let them play, right? I mean, we in pediatric cardiology will find a way to let our children play, even if they have really bad disorders. We want them to play because people who exercise, people who participate in especially a team sport, and I was a tennis player. Tennis is a singular sport, but you're on a team and you're rooting, you develop friendships, your likelihood of depression, anxiety are a whole lot less. You learn how to get along with other people, see things from other people's perspective. So I would say go to the doctor, get the clearance, figure out exactly what they can do. And if it's billiards, ping pong, or whatever it is on the sheet, then encourage your children to play and play with them.
Yes, I love that so much. It is not about keeping kids out of sports or out of playing. It is about figuring out what they need so that they can play. I love that so much. Thank you so much, Dr. Christopher Snyder, for joining us today.
No problem. Thank you very much.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on YouTube, Instagram, Facebook, and Threads at Healthy Children AAP. And be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos,
Kathy Jewell,
Claire Keating,
Doug Nagel,
Jackie Ortega,
Susan Stevens-Martin,
Mary Claire Walsh,
Hannah Weston.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho-Sanchez. Thanks for listening.